Indonesia and South Korea to develop electric bus ecosystem in Bali. And the government says COVID cases are increasing, but don't panic. Stay tuned for details. Selamat siang. Welcome to the latest news from Bali and Indonesia. This is December 16th, 2023, and a happy birthday to my youngest daughter, Meredith. 25 years old now. Wow. And what is the weather like? Oh, my name's Bruce, in case you didn't know. What's the weather like right now? 31.9 degrees Celsius, 66% humidity, and wind speed 14.3 kilometers per hour. This morning at 9 o'clock, it was 28, and so it's already up to almost 32. So another steamy day here in the kampung. And no rain, no rain, no rain. It is still dry. Yesterday, we did get some rain. Not long, it was about an hour, but I put down my rain curtains to keep it off the balcony. So seems like the climate is trying to move into the rainy season, but it just can't quite get there yet. So let's hope that we get some more rain soon. Okay, let's get into it. Indonesia and South Korea join hands to develop electric bus ecosystem in Bali. Indonesia and South Korea signed an agreement this past Wednesday on the development of an electric vehicle ecosystem for public transportation services in Bali. Representatives from the Maritime Transportation Ministry and the Development Planning Agency were there, along with a representative from South Korea from the Global Green Growth Institute, GGGI. Remember that, I'm going to talk about that again. The electric bus ecosystem will be in the greater Denpasar metropolitan area, consisting of Denpasar City and the neighboring regencies of Badung, Tabanan, and Gianyar, also known by the acronym Sarbagita. The implementation will start in Greater Denpasar because its infrastructure is the most prepared. After that, the electric transition will spread to Klungkung, as the regency has the potential for economic growth. Ah, really? With the construction of the Bali Cultural Center. Ah, yes. Bali Transportation Agency Chief Pak Gunarta said the public transportation project had been planned since 2022 through the Regional Action Plan, and the project was issued a gubernatorial decree in 2019, and they've been thinking about how to go about doing it since then. Do things get done quickly here? Not often. The ecosystem project development encompasses the procurement of the buses, charging stations, routes, and sidewalk planning, and field operator preparation. The development of the electric bus network is part of Indonesia's target of becoming net zero by 2060. Transportation is the sector that contributes the second most emissions. The sector is projected to contribute up to 9.93% in reducing greenhouse gas emissions. The EV system project in Bali is expected to be worth about $8.8 million US. The GGGI will assist in the project's feasibility studies, implementation, finance, electric bus provisions, and ecosystem support until December of 2027. Currently, the world is focusing on adopting zero-emission technologies, including the transportation sector. The GGGI seeks to support the government in adopting a bus ecosystem, starting in Bali and then later expanding to other regions in Indonesia. Think big. Currently, the agency operates the Trans-Sarbagita bus rapid transit system with 2 operational corridors and 3 feeder routes. Meanwhile, the Transportation Ministry operates 5 corridors of the Trans-Metro Dewata, which also serves the greater Denpasar area, and seems like it is empty most of the time. There is also a plan to build a light rail transit, the LRT system, linking Ngurah Airport with Badung and the neighboring locations, Kuta, Legian, and Seminyak. Good news, though, about the bus system, all right? I don't know if people are going to use it. You know, at this point, people are really attached to going places on their motorbike. It's convenient, it's quick, gasoline is still not enormously expensive. Maybe 30 years ago when people were still using public transportation a lot, but it's going to be hard to get people into the habit of using public transportation, and the government has admitted that. And so we'll just have to see. But it's worthwhile trying. Okay, now, last time I talked a little bit about COVID, right? Well, there's a lot of news about COVID now, and that's basically what the rest of this is about. Why is this important? Because who knows what's going to happen in the future. Right now, things are okay, but there is false information already coming out on social media about you're going to have to do this, you're going to have to do this. Numbers way higher than they actually are, or numbers way lower than they actually are. And so, taking this from the news from yesterday and the day before yesterday, best to be prepared and know what happens, because if you were here during the pandemic, you know about mask wearing and all that stuff. And so let's take a look and see what we've got. Health Agency, don't panic. COVID-19 surge may occur every 6 months. The agency's head of the Surveillance, Epidemiology, and Immunization Unit said the increase in infections could be expected every 6 months in line with the change of seasons and the weakening of the immune system. During the current endemic phase, activity restriction is not yet necessary, and individuals should take responsibility for maintaining their health. Ibu Nabila said the agency was aiming for 0 deaths during the endemic period. She said the government is currently focusing on promoting and providing vaccinations and conducting free PCR tests. People, particularly vulnerable ones, are strongly encouraged to get the booster dose of the COVID-19 vaccine because if they're infected, they have a higher risk of death. Okay, that's us old people and people with comorbidities. Ibu Nabila explained that unvaccinated people or those with immunodeficiency could create new viral mutations. The coronavirus will continue to mutate to become more contagious. However, it should not make the cases worse, she said, because the symptoms should be milder. The infection, she went on, could be severe in unvaccinated people. The booster vaccine increases the antibodies to fight against the virus, so it's better to be vaccinated late than never, she said. For people who are having a cough or a cold, she said it's better to postpone vaccination until they recover. People who test positive for COVID can get a vaccination 1 month after they are declared cured. The COVID vaccine can be delayed at least 14 days after receiving other vaccines. Okay, some general background. Soekarno-Hatta Airport to reimpose health protocols amid rising COVID-19 trend. Pay attention to this so that you don't get any misinformation. No, you are not required to do anything at this point. Soekarno-Hatta International Airport's health office is gearing up to reimpose COVID-19 health protocols due to increasing numbers of COVID-19 cases in Singapore and Malaysia. Passengers will be urged, not required, urged to wear masks and maintain personal hygiene at the airport to prevent COVID-19 transmission. In the airport, wearing masks and maintaining hand hygiene will again be recommended. All airlines are also advised to implement health protocols, according to the airport's Port Health Office. The airport's management is taking into account the possibility of a high passenger influx from both local and international flights, especially during the upcoming year-end holidays, by gearing up to implement health protocols. As a preventive measure and to prepare for Christmas and New Year, once again we are tightening supervision of domestic and international travelers who enter the airport, according to a spokesperson. The health protocol will involve a team of doctors and a task force to conduct health checks for both inbound and outbound passengers. He added that the airport's management has also prepared health facilities in the airport for passengers found to be exhibiting symptoms of COVID-19. According to the health ministry, the prevalence of COVID in Indonesia has been surging recently, with 298 confirmed patients reported in the last week alone. In response, the ministry has recommended the public to complete COVID-19 vaccination doses, including primary and booster doses. There's a wave of infections apparently going on in the United States and Europe, and over here in Asia now too. So we know what's happening in Jakarta at the airport there. What about here in Bali? COVID-19 cases increase. Passengers at Ngurah Airport urged to comply with health protocols. Anticipating the surge in cases of COVID-19 in Bali and Indonesia in general, Angkasa Pura I, as the manager of Bali's airport, continues to increase its vigilance. We will continue to coordinate with all stakeholders, especially the Port Health Office, to ensure mitigation for increasing awareness of the COVID-19 surge, according to the general manager. He added, checks will be carried out using body temperature detection devices, thermal scanners, at the departure and arrival points with 5 thermal scanner units, and identify passengers who may be showing symptoms. He was asked whether they would immediately re-implement the COVID-19 health protocols for passengers and workers at the airport, and he said his party is supporting the government's efforts to anticipate COVID-19, and that, of course, if there are policies that are issued, they will be implemented. First, we wait for the relevant ministry's regulations so that implementation can run smoothly, he said. As for now, we are still coordinating and waiting for regulations. This cannot be separated from the early mitigation implemented by the Ministry of Maritime Affairs and Fisheries at the airport in Bali, and the use of masks. We are still appealing to users to wear masks. We appeal to people who will be flying to pay attention to their health conditions and comply with health protocols so they can fly healthily and safely. The head of BPBD, Pak Made Renton, talked about many times, said that there's no special rules for travelers inside or outside for the holiday New Year's season related to the virus. Local governments, however, are instructed to pay attention to the completeness of vaccinations and boosters, and foreigners will be allowed to get booster shots here. The circular emphasizes the need to increase vigilance through several steps, such as vaccination monitoring situation, identifying the vaccination status of travelers, strict supervision of travelers, and increasing educational communication to the public. The spread of COVID-19 in Bali is increasing. Residents don't need to panic because it's endemic. The head of disease prevention and control of the Badung Health Service said that there are a number of patients in Badung who have COVID, and it is up to 25. However, he asked residents to calm down. Previously, the Bali Health Service recorded that since early December 2023, there are 60 cases of COVID in Bali, or have been, and that one person out of those 60 has died. Regions reporting people infected with COVID include Jembrana 8, Gianyar 6, Karangasem 9, Buleleng 1, Tabanan 1, and Denpasar 11. According to the spokesperson, people do not need to panic even though there is a spike in cases, because the current situation is different from when COVID was declared a pandemic. He said the treatment has been measured, everything is under control, vaccinations are underway. The level of community immunity is increasing. Say that, community immunity 3 times. He suggested that health protocols be implemented when visiting health facilities and public spaces that are prone to disease transmission. It means if you go to government offices, hospitals, doctors, dentists, wear a mask. Moreover, Bali is ready to welcome a surge of people for Christmas and New Year's. He said, people wear masks. Cough etiquette should also be maintained. And of course, nutrition should be increased for the body's immune system. So, if you're here and you're going to be going to a government office, for example, it might be a good idea to take a mask with you if you don't want to wear one. Now, some people may want to wear one, but it would not hurt just to have one in your pocket in case they require you to wear one. It's not being done yet, though. It is not a requirement as of today. This is Saturday, the 16th. But you can never tell. So the government's getting ready. They're getting the puskesmases and hospitals and all health facilities ready to go in case there is a spike in cases. And the regional governments and health ministries in the regional governments have all been contacted and told to be prepared in case numbers rise in their region or around the island as a whole. So if you are coming into Bali, you're probably going to be thermally scanned. Now, I don't know, has anybody come into Bali in the last day or two since this came out? the thermal scanners up already? Have you been scanned? What have you seen anybody that has tested hot? And what's happened to them? I don't know. We'll just have to wait and see. Okay, one more segment. Ubud becomes pilot project for World Gastronomic Destination Development. Oh, great. Ministry of Tourism and Creative Economy, Pak Sandiago Uno, gave a virtual speech for the opening workshop for WTO Gastronomy Tourism Development at the Royal Pita Maha Hotel. Pak Sandiago said that the variety of traditional culinary delights in Ubud is not just about food, but is integrated with local cultural wisdom in Bali. Ubud was declared a pilot project for developing world gastronomic destinations. For all of you foodies. One of the quick steps that was taken after determining Ubud as a world gastronomic destination was the formation of the Ubud Gastronomy Club. This community will later become a forum for sharing experiences and knowledge about gastronomy, not only about food, but also the history and process of food itself. The Ministry of Cultural, Creative Economy and Tourism hopes that this will become a success story which will be implemented in other leading destinations in the future. Ubud's gastronomy has long been an attraction that dominates tourist interest in visiting Bali. We have a tourism portfolio. The main purpose of tourists visiting Bali in Indonesia, 60% for culture, 30% for nature, 5% for artificial tourism. What is artificial tourism? 60% for culture? Really? I was watching thousands on a video just a little while ago down in Canggu. Different kind of culture. Why are we developing gastronomy? Because it's very popular with tourists. This is one more thing for Bali. You're looking at all these different ways to bring in tourists. And here is another one. They're going to be a gastronomic center. Let's bring in more and more tourists. Okay, that's it. Thanks for viewing. Be kind to someone today. Stay safe. And I will see you next time.